Just like breast cancer surgery is no more about mastectomy, axillary surgery is no more about dissection. So axillary surgery means whenever there is a tumor in the breast or cancer in the breast, there is a chance that it can spread to the lymph nodes in the armpit. So the armpit is known as axilla. So whenever we do surgery for the breast, we also need to address the armpit nodes or the axillary lymph nodes. Because we pick up cancer early, it is not necessary that the nodes are always involved, but they have to be sampled. So the recent procedure that we use for addressing the axilla is called a sentinel lymph node biopsy. So during the operation, we inject a dye. It could be a blue dye, or it could be a fluorescent dye, which we call it as ICG, or it could be a radioactive colloid tagged with technetium. So this dye is usually traced along the lymphatics, and then a small cut is made in the armpit or the axilla, and with special probes, either a gamma probe or an ICG probe, the lymph nodes, 1 to 2 lymph nodes, which we call as the sentinel lymph nodes that take up the dye, they are dissected out and tested under the microscope. If it is involved, then further dissection is required. This procedure helps us in preventing lymphedema. So around 75% of the women in whom the lymph nodes are not involved, we are able to spare the axilla. So such recent advances may not be available in many centers, in many remote places. But now, because of medical tourism, everything is made accessible, affordable, and available to everyone in every nook and corner of the world. So be sure to avail the correct facilities to get the correct treatment. Thank you.